abuse, neglect, and mandatory reporting. As a home health aide, you are a trusted caregiver in your client's life. With this role comes the serious responsibility of recognizing and preventing any form of abuse or neglect, and reporting it when necessary. This lesson will teach you how to identify abuse and neglect, understand the signs and symptoms, and carry out your legal and ethical duty to report these issues. Your prompt action can save a life, protect a vulnerable individual, and fulfill the ethical standards of your role. Let's begin. Understanding abuse. What is abuse? Abuse is any intentional act that causes harm or serious risk of harm to a vulnerable person. It can be physical, emotional, sexual, financial, or verbal in nature. Types of abuse. Physical abuse. Hitting, slapping, pushing, burning, or restraining. Signs: unexplained bruises, fractures, fear of caregiver. Emotional, psychological abuse. Threats, insults, yelling, intimidation, humiliation. Signs: withdrawal, fear, depression, low self-esteem. Sexual abuse. Non-consensual sexual contact, inappropriate touching or comments. Signs: bruising in genital areas, panic when touched, STIs. Financial abuse. Stealing money, forging checks, misusing credit cards or benefits. Signs: sudden bank account changes, unpaid bills, missing valuables. Verbal abuse. Name-calling, threats, manipulation, or derogatory language. Signs: emotional distress, crying, low mood after conversations. Abuse may be committed by family members, other caregivers, or even professionals. Understanding neglect. What is neglect? Neglect occurs when a caregiver fails to provide the necessary care, resulting in harm or risk of harm to the client. It may be intentional or due to lack of training or attention. Types of neglect. Physical neglect. Not assisting with hygiene, nutrition, or safety. Example: leaving a client in soiled linens for hours. Medical neglect. Failing to provide access to medications, treatments, or appointments. Example: ignoring instructions to monitor blood sugar. Emotional neglect. Ignoring the client's need for interaction or reassurance. Example: not responding when the client expresses pain or fear. Signs of neglect: weight loss, dehydration, pressure sores, poor hygiene, unsafe home environment, isolation and loneliness. Neglect is just as serious as abuse and must be reported immediately. Legal requirement. Mandatory reporting. Who is a mandated reporter? As an HHA, you are a mandated reporter. This means you are legally required to report any suspected abuse or neglect of a client, even if you are not completely sure. You do not need proof, just reasonable suspicion is enough. Who to report to? Your immediate supervisor or agency nurse. Adult Protective Services, APS. Emergency Services, 911, if the client is in immediate danger. What to include in a report: client's name and location, description of suspected abuse, neglect, your observations, what you saw or heard, names of suspected abusers, if known, time and date of incident or discovery. Do not delay. Report immediately and document your actions. Protecting the client and yourself. Steps to take if you suspect abuse or neglect. Ensure the client is safe. Call 911 if necessary. Report the incident to your supervisor or the proper agency. Do not confront the abuser. Document everything factually and clearly. What not to do. Don't wait for proof. Don't investigate yourself. Don't ignore signs. Don't gossip about the situation. Your role is to observe, report, and protect, not to judge or intervene directly unless safety is at stake. Building trust and preventing abuse. How HHAs help prevent abuse. Treat clients with respect and dignity. Promote client independence as much as possible. Observe and report changes in mood, behavior, or physical condition. Communicate openly and compassionately. Support the client's right to privacy and autonomy. Creating a safe, respectful environment reduces the risk of both abuse and neglect. Abuse and neglect have no place in home care. You are on the front line of defense for vulnerable clients. Understanding what abuse and neglect look like and taking immediate action to report them is a vital part of your professional role. You are the client's advocate, and fulfilling your legal duty to report helps protect their rights, safety, and dignity. When in doubt, speak up. Your voice matters. You are the client's advocate. By speaking up, you protect their safety, dignity, and rights. When in doubt, act. Your voice can change a life.